Hello, everyone, and welcome to the Physical Therapy webinar series. This is Jessica from QRSMA's Family Support Department, and we're so glad to have you all join us today for today's presentation. This program was launched to be able to provide valuable information to the community on home exercises, all shared by licensed physical therapists. Be sure to have those resistance bands that were mailed out to you ready to follow along for today. And thank you so much to our presenting sponsor, Biogen, and supporting sponsor, the Luke 18 Foundation, for generously supporting this series. We appreciate all the questions that we've received in advance of this webinar, and we'll try to answer as many of these as we can during the presentation and Q&A. You're also able to submit questions throughout the webinar using the questions box, and you can find that located in your GoToWebinar toolbar. Please note that all lines will remain muted during the webinar other than for the speakers. And if you have any additional questions after the presentation, please contact the QRSMA Family Support Team at familysupport@qrsma.org. And now we'd like to welcome our speakers, Leslie Nelson and Tina Duong, who will be sharing their interactive presentation, Pediatric Discussion on Home Exercises with a Physical Therapist. Hello, Tina and Leslie.
And Tina and I are very excited to have you all with us. And I think when we were asked to talk about exercise, it was one of those things where, as physical therapists, we love talking about it. But if you think about exercise, it's a huge topic. And then, you know, it's something that we all need to do. And Dr. Robert Butler, who was the founder of the National Institute on Aging, actually said that if exercise could be packaged into a pill, it would be the single most widely prescribed and beneficial medication in the nation. And if you think about that, it really is beneficial for all of us. But there's a lot of questions, and I think that if you're even myself, when I go to start an exercise type of a program, it's that question of where do I even start? And so hopefully our goal will be to give you all some education on just some general guidelines and potential options to help support some exercise and just an active lifestyle for children that have SMA. And then you throw in the fact that we are in a new era. We have new therapeutics, which is wonderful, and we know that we are now potentially seeing improvements or acquisition of new milestones or new abilities, and that's exciting. And what we didn't have even before we had these disease-modifying therapies was a lot of information on exercise, and now we even need more data to really understand what the effects of exercise will be on the disease trajectory of those with SMA. And then we even still have some need for some patients where the disease-modifying therapies are not an option. And so we still need to understand how exercise can be used in those individuals and help promote function and manage any possible decline in those patients as well. When we think about exercise, back to that thought of a pill, exercise really does need to be dosed, just like a prescription that the doctor gives you, like a pill that you take. And so there's a lot that goes into that thought process, and we hope today to give you a little bit of information so that you'll understand that and be able to apply what you've learned to some different exercise ideas at home. But what we would say is that it really is good to refer to your healthcare professionals, your physical therapists, and your physicians before you start any exercise regimen, and even especially cardiologists for the possibility of any exercise intolerance or issues from the standpoint of just the heart health. When we talk about exercise, the other thing to keep in mind is that when we think about exercise, there are a lot of different avenues that you can address exercise. And that when I say that, what I mean is that exercise should encompass flexibility and stretching, as well as working on endurance, which might include not only cardiovascular endurance, but postural and endurance and core strength and endurance. And then there's the thought process of strengthening and actually building muscle or building strength in your muscles. And so you really do want to try to incorporate all three of those aspects into an exercise program. By doing that, you do need to think about how much resistance that you're going to use, and typically you'll use a lower resistance with a lot more repetition to work on endurance type of in strength, and then higher resistance with fewer repetitions to work on more muscle strength. And what we would say is that we would recommend that you do stay within more of a submaximal or a moderate resistance, and basically to help avoid fatigue and to help avoid overworking muscles. So fatigue is a byproduct of exercise in the respect that when you're working the muscles, you are potentially breaking them down in regards to building them back up for strengthening. And so if you do over fatigue and overwork, you can get what we would call overwork weakness, and that's something that you do want to avoid. And what we would say there is, from a standpoint of understanding how much is too much or how much is enough, we're going to talk to you a little bit about intensity and how you might gauge how much you should be doing. And so we'll hope to answer that question as we talk. We'll talk a little bit about frequency when we talk about exercising in moderation, and not only frequency but also intensity, and understanding how you can use kind of your perceived exertion in order to modify and monitor how much exercise is enough and is the right amount. We also would say that it'd be great if we could just give you one presentation and say all of this applies to every single one of you. And what we're going to say, though, is that really it does depend. So your exercise program does need to be personalized to you, and things you have to think about are what are your current activities and exercise regimens, and how do you build upon that? If you're not exercising, how do you start? And so we'll show you a little bit of an idea of maybe even using an exercise calendar to potentially monitor over time and help modify over time as you need. And you may need some supervision in that monitoring to modify. One exercise that you start today is not necessarily going to be the same exercise that you need to be doing in 6 months. Exercise itself is not a static prescription. It doesn't stay the same in a lot of situations. You do have to modify it as your body adapts to exercise. And so those are things to keep in mind. So I mentioned that we want to incorporate 3 different aspects of exercise, which include flexibility and stretching, and then endurance and cardiovascular training, as well as strength training. And I mentioned a little bit about how you would, the difference between that. Endurance is more of a lower resistance, higher repetitions. You do much more of that to work on endurance, whereas strength training is typically more higher resistance with lower repetitions. Starting with endurance and cardiovascular exercise, the first thing from a cardiovascular standpoint is what we would call aerobic exercise. And aerobic exercise can encompass anywhere from walking, whether that be on a treadmill or over ground, or even walking in the water, or using stationary bicycles or elliptical machines or rowing machines. And the bicycle doesn't necessarily have to be a leg bicycle. It could be an upper extremity or an arm bike as well. And there are lots of different options for bikes and trikes that you can potentially look into getting that would be beneficial depending on the capability of the person that's going to be using it. And then aquatics can be a great aerobic exercise, and aquatics can be great for kids just because the water's fun, and that's important when you start to incorporate an exercise program as well. You may need to have assistive technology or assistive devices or orthotics or braces that will help with the different support that you might need at different joints. And so you may want to follow up with your physical therapist or your physician to kind of see what are things that we might be able to use in addition to just exercise alone that may help with moving forward for cardiovascular exercise. And then when we talk about endurance, I mentioned a little bit before that we're talking there, if you think about core or proximal stabilization and endurance. And what I mean by that is if you think about our trunk and our neck muscles, those muscles have to work at a lower intensity all day long. Whereas when I go to lift something, my bicep works in more of a strengthening kind of component. So when we think about core and proximal stabilization, we're talking really about the neck and the trunk and those types of muscles that we want to be able to work for long periods of time. When we talk about strengthening exercise, there are different types of strength exercises, and you may hear they're called isometric, concentric, and eccentric. Isometric can be great exercises to help even build bone density, and in patients that may have limited range of motion, isometric exercise may be very beneficial. So isometric exercise is when basically the limb or the body part is not moving. It's staying static, but it's still contracting. And then concentric and eccentric are basically just the way that the muscle's moving and contracting. So if I think about concentric, the muscle is shortening, so I'm bringing the lever arm closer to me, versus eccentric, it's lengthening, so the muscle's lengthening. And so if you think about eccentric muscles going downstairs, kind of lowering yourself down a stair, uses a lot of eccentric strength. And stabilization is an important component of the strength exercise itself. And what do we mean by that is if I'm exercising something from a standpoint of I'm exercising my arm, I need my shoulder to be stable. And I want to be aware of compensations. So if I start to move in a way that's not the way that muscle is supposed to work, or I start to engage other muscles to start to do the work of that muscle, I want to be aware of that, because that may mean that I'm overworking. If I can't continue to lift my or bend my elbow in a nice steady manner, if it's starting to be shaky, or if I'm having to lean forward in order to bend my elbow, I'm compensating it, which means that that muscle is getting tired. And then from a standpoint of strengthening, you may want to consider things such as yoga or hippotherapy or even adaptive sports programs. And those are all really nice ways to incorporate exercise and strengthening, and can sometimes be fun because you're with peers and with other people. When you talk about strengthening, you do want to, we will talk a little bit about the FITT principles, which is the frequency, how often you should exercise or strengthen, the intensity, and how hard you should exercise or strengthen. And when we talk about intensity, we'll talk a little bit about how you can use your rate of perceived exertion, which means how hard you feel like you're exercising, or you can actually calculate intensity by using your heart rate. You use your age minus 220, and that's kind of the maximum heart rate at which you would want to exercise at. Time is more duration. Should I exercise for 15 minutes? Should I exercise for 30 minutes? How do you know? And what I would say there is that a lot of times you look at what are you currently doing and build up. And we know what your goal may be. Your goal may be 30 minutes, 2 to 3 times a week, but you may not be able to do that today. You may have to start with 10 minutes and do 10 minutes a couple of times a day and then build up on that, and that's okay. And then type, again, you're determining, am I working on strength or am I working on endurance? There is, if you're not aware, guidelines for recommendations for exercise in general, that the standard of care document that's published is out and that you can use. We've listed here some of the guidelines that are in the rehab section and the orthopedic section. So for instance, for our patients that are unable to sit, stretching is an important component of the exercise program, and minimal frequency for stretching should be 3 to 5 times a week. Bracing 5 times a week. And again, those are minimal. If you do them more often than that, that's great, but kind of minimal guidelines were set out in this document. For our patients that can sit, again, we would stretch 5 to 7 times a week and brace 5 times a week. And then standing programs can be important. You would build up to where you're standing in a standing frame or in bracing for up to 60 minutes. and do that about 3 to 5 times a week. And then for our patients that can walk, we would recommend aerobic exercise, whether that be walking or riding a bike or those kinds of things, for at least 30 minutes, 2 to 3 times a week. And a minimal frequency for stretching would be 2 to 3 times a week. So again, just some guidelines there that may help with kind of understanding how often we should exercise. I mentioned with intensity, you could use your heart rate max, but we know that there's also kind of your perceived exertion that goes hand in hand with what that heart rate max may be. And so moderate RPE of about a 5 to a 6 is what we would probably recommend that you stay within, which would correlate to a heart rate max percentage of about 64 to 76%. You can use, especially in kids, this is the Omni scale of perceived exertion, and it uses kind of these caricatures of how hard a young boy is working. And so again, you'd give them that scale and kind of say, I want you to you feel like you're working, but not so hard that you can't keep going, that you're very, very tired. So that can sometimes be helpful. And then there's actually, guidelines for what a 5 or a 6 would be. And I sometimes will tell patients that if you can keep a conversation going while you're working, but you're tired and a little bit out of breath, then that's probably right about where you need to be. And then now I'm going to pass it over to Tina. I'm going to let you start and talk a little bit about how we can, even, especially in regards to kids, how even playing is exercising.
All right. Thanks, Leslie. I appreciate it. So Leslie laid a really nice foundation on some of the things that you should think about with exercise. Being pediatric therapists, I think whenever when we're practicing, you look, you go to the gym or you go take your child to PT and they're like, well, they're not doing anything but playing. Well, that means they're doing a great job, because just because your child has SMA doesn't mean that they have to do boring exercises that are at the gym. So being a PT, you get to be a little bit more creative on how you approach strengthening and exercises, because all movement is some form of exercise. What Leslie was mentioning about stretching, the reason why stretching is part of the standards of care is to make movement easier. So if your muscles are tighter and in addition to it, they're weak, it's going to be harder to move. And so there's preparatory work that could help your child be successful when they do engage in play and activation of their muscles. And so we suggest there's some nice positioning, especially prone positioning for children who are in wheelchairs. That would be nice to ensure that they get their hip flexors nice and stretched out. Another way of playing is, which we do, and it's kind of mean, but it's helpful, is to put toys out of reach to encourage them to roll or walk, especially with infants. We do this all the time, but it's one of those things that with infants we can encourage, but have certain handling that Leslie and I will talk about a little bit to ensure that you get them to be successful, providing just enough positioning or handling with your hands to make them successful, so it's a positive reinforcement. And of course, there's uses of wedges and pillows and propping and things that will allow them to be more successful. For example, if they have a hard time reaching up and playing with their toys, you may want to prop them onto their side so they're playing with that toy and they're encouraged to play with that toy. So next time when you present the toy, they are more encouraged to reach for it. In various sitting positions, you may want to do this to change the amount or the type of work that's done. And this is where it's helpful to progress your exercise session with a physical therapist, where they're breaking down the task of what you're wanting to exercise, but doing it in a fashion that is personalized to your child's abilities. And of course, as if your child's walking and jumping, you want to encourage basic developmental milestones, playing games, hopscotch and climbing on the playground, and of course adaptive sports. Because remember, exercise is not it's not an independent sport. We learn a lot how to socialize, how to communicate and play and work as a team when we do work together playing sports and such. Okay, so some of the considerations for handling. We'll talk a lot about proximal stability and control, and Leslie mentioned this with trunk control and head control, but we'll also talk about this with pelvis, the pelvic control. Having that proximal stability, meaning that's an isometric contraction that Leslie was talking about. Both sides of a joint is contracting together to hold a body part in place. Sometimes we do this with techniques we call compression or even garments or bracing. They kind of act as an external isometric hold for your child. And so as your child's getting stronger, or on treatment, what you may want to do is emphasize more of the muscles doing that work compared to braces and such doing that work. Other things that would be helpful for progression of strengthening would be using lighter weight toys, different switches for encouragement, and of course slings and springs that we'll show you to take away the weight of gravity so that your child's able to go through the process of learning and playing. And of course, with caregivers, don't forget about your own health and body mechanics and posture. This is definitely something that you can also talk to the PT who's seeing your child on how better to position yourself so you can handle or encourage your child in a way that doesn't put extra pressure on your back or spine. Okay. And everyone got a package of resistance bands. So Leslie and I thought we should explain the bands. I know that some of the kids just like the colors of the bands. So luckily we don't have pink. Otherwise, all the girls seem to want pink. So you'll have yellow, red, green, and blue. No, yellow, red, and green, I believe. And there are just different levels of resistance. Yellow is the lightest, red is a medium, and green is the heaviest. And you can use that to increase your intensity as your child gets stronger or different muscle groups are stronger. Also, we want to talk about the length and the tautness of the bands. So that gives you a little bit more degree of resistance as well. If the bands are slack, it may be you may have to work a little bit harder, but if you make it more taut, then there's more resistance work that you want to work through. And what we would like to encourage in all your exercises is to work through the entire range of motion. And that means that different muscle fibers have different strength levels. And so you may need, your child may need a little bit more assistance when, for example, say they're trying to flex their arm and gravity's hitting on it really hard to get it up off the table. You may just want to assist it just a little bit. And as gravity has less effect, they may be a little bit stronger in this range. And then you could add that resistance. So you can vary the intensity of strengthening throughout the range of motion so that it's very specific to your child. Okay, and so we'll start with a few of these videos. I'll just kind of talk through the trunk stabilization one. The reason why we address this first is because this is applicable to whether your child's sitting, standing, walking, all of us. And actually, it's good for you as caregivers too, because it allows us to strengthen our core where everything else can function from. So a lot of times, most of us don't know how to activate our trunk. And so this first video is me basically showing this young lady how to activate her abs. And so when you haven't done it, you don't know what it feels like. And so I have my hand underneath and I'm just asking her to push down on her stomach. And another fun thing that you can kind of do is use a ball. What I have here is basically having her activate her pelvis by rolling the ball up and down. And she does that by moving her pelvis. And the other video is me doing it, showing it with a larger ball. So here, if you put your fingers together, when the ball rolls down towards your fingers, you're arching your back. And then the most important part is the ball going towards your thumb. That would flatten the lower back and really engage the muscles when they're laying down. This could be done in supine. This could be done in side lying or sitting. But I'd say, we would say start in supine. Just so that you learn how to engage those. And that's kind of the essential part, foundation to movement. And so here is just another example of using this and using your hands to facilitate. So in this one, I'm helping a young lady activate her pelvis at the same time. So I'm having her squeeze the ball together and she's having a difficult time with the hip movement. So I have my hands to kind of encourage that anterior and posterior tilt is what we call it. So you could see here, I'm having her push her back down into the wall, the mat, and then I'm having her move it forward, similar to the example you saw earlier with the ball at the belly button. And so depending on your child's ability to do that, this is another way to facilitate that type of movement. And the ball is kind of nice too, because you add some hip girdle strengthening at the same time.
Okay.
Great. Did you want me to go through?
No, I can do it, this one. So we did go through and kind of talk through. So now that Tina's talked a little bit about that initial stabilization that everybody really needs to understand and know, we did want to go through and talk a little bit as far as depending on what your child or your family member or yourself are able to do, and think about what your goals might be. And so if you are a patient that is unable to sit, things that you want to think about is really from a goal standpoint, you want to optimize your function. And what does that mean? Well, that means if I'm able to roll in bed and optimize my bed mobility and those kinds of things, or if I can lift my arm when I'm supported to help with eating, or those kinds of different things, we want to do exercises that will help optimize those actions and then minimize impairments. And that means try to minimize or prevent any tightness or contractures that may occur. And then optimizing tolerance to various positions are really just getting to where you can tolerate, even if it's on your stomach, prone on your belly, or different sitting, propped sitting or upright sitting, different tolerance to just those various positions. So to do those things, you'll work on trunk and head stabilization. You may need to use what we would call gravity eliminated strengthening, and that's what Tina alluded to as far as kind of taking the weight of the toy or the weight of the arm out of the picture. And then aquatic therapy and chest physical therapy are important considerations as well. So this is just an example when we mentioned using slings and springs. This is an example of someone that put together just a PVC pipe type of a contraption where you can then hang your sling from that, and the infant or the child can be lying underneath, and then the hand or the foot can actually go within the sling, and that takes the weight of the arm or the leg away, and it's easier to move. And so there are a variety of different places where you can buy materials to find slings. Amazon actually sells nylon slings of various lengths that you could use. You can actually purchase fabric or sew strips and secure with Velcro or buttons. And then I have had families that have just used the TheraBand, like the TheraBand that you got from Cure SMA, that they've used tied around the bars. So just an example of something that you might find useful to help with that gravity eliminated type of movement. So Tina, I'll let you talk about this exercise.
Okay, so here Leslie and I were just wanting to show some handling and facilitation techniques, because we get a lot of questions about, okay, so you say activate this muscle, but how? This one is where we're looking at for postural muscles, looking at squeezing the shoulder blades together. And so one of the things that we talk about is a movement together. So we want the patient here to push her shoulders down and back. And she's not used to doing that. And so we're giving some stimulation to show her how to do that. And so I'm asking her to squeeze her shoulder blades together. And so she feels where my hands are, and I'm kind of pushing down on her shoulder at the same time. The next part of the video kind of translates that to functionally. Now that she has learned how to activate those muscles, how does that translate to something that she may do sitting up? And so here I'm doing the same thing and showing her push down through your shoulders and push down through that ball and then roll it forward. And so tasks like these are tasks that you may do on an everyday basis in different scenarios, but you always need that shoulder stabilization to ensure that you don't have increased repetitive injuries or anything from using momentum to swing your arms around.
So this next one is just an example of how you might use the band in when you're lying on your back, or what we would call supine, and working on upper extremity kind of stabilization and strength, as well as core strength, having to pull against that resistance of that band and rolling onto your side. So if you the other thing that we wanted to show from this video is that with the bands, you can alter the resistance by the angle at which you hold them. So depending on whether or not your line of pull is directly out away from where you're rolling, or when I move down toward the foot of the bed, that's going to change how difficult that is for the resistance for the rolling. And so you may need to back off if it's too hard, or you may need to pull tighter on the band if it's too easy. So finding ways to kind of make things easier or harder depending on what you need to work the muscles effectively is something to keep in mind with the bands. And then this is another example just on lying on your back, how you can work your arm muscles. So here we're working the tricep by extending the elbow, making the arm go straight. And you can see that holding that band, she's at the very end of the range of motion, having a little bit of difficulty getting to that full end range of available extension, being able to straighten that arm all the way. So it may be that I need to put a little bit more slack in that band and allow her. So this is another example. Now we're working the bicep, where you're bending the elbow, and at that end part of the range, it's very difficult. But if I give her a little bit of slack, now she's able to move further through her range of motion. So she's working that muscle all the way through the available range rather than just the end range. And thinking through how you might adjust that band is important when you're working with them. Okay, Tina?
So we thought we'd give you some examples of kind of a sling and springs, because now you can exercise with your kids. And so here I'm kind of using the band one to hold her leg up, and the other one is to assist in a gravity eliminated position, and I'm asking her to bend her knee, basically, so for trying to get her to move through the entire range of motion. So you have to have patience with this. As you're holding the band, you can feel the initiation of movement, so allow time for your child to initiate that movement, and as they initiate it, they can't move through it, you give that assist, and with time they'll gain more strength throughout that range of motion. Okay. And then this is another example for someone who's sitting, where you could kind of do some pelvic girdle exercises. So here I'm moving the band. I have the band out, and she's pulling her leg in, and then on top of it we can work on rotation, where I'm having her point her knees up. Okay, and then similar to what Leslie was showing on the upper extremity, you can now also move the band to the other side, and now she's going to use the outside part of her hips to pull the band away. So then you're working the hip adductors, which brings the legs in, and now you're working the hip abductors, which brings the leg out. And then with her, she has some difficulty maintaining a rotation, so she's also adding the rotation piece of it. And of course, you can change that intensity with how taut you're pulling the band.
The other thing I'll say about this, Tina, is the fact that if you notice, Tina's supporting her a little bit through her trunk and through her upper body. And so again, if you feel like that the exercise is too difficult because she's having to focus on keeping herself upright and do the exercise, then give a little bit more support. Put her up against a sturdy chair or against the sofa, those kinds of things, where she's got more support through the trunk, so she's able to focus more on the leg muscles that she's working on. And so thinking through kind of how you have everything set up will make a difference in what you're concentrating on working as well.
Yeah, that's a really good point.
Okay.
So this one's are heel slides that you could do. You could do it without the bands, but here's just an example of where she can assist in the heel slides themselves. So she could work on bending the knee up, and then the band kind of gives her assistance, because as you know, with some of your kids, they're able to move their leg part of the way up, but not the entire way. So with the band at the bottom of the feet, she could keep her foot there a little bit better. And then on top of it, you can work the opposite end where she's working again her butt muscle. Basically, she's pushing out and getting her hip extensors in there. So that's a nice way of kind of working, moving her leg up as well as the hip extensors going down. And she can vary that herself if she has the upper extremity strength, but of course you can also do the same. And we obviously had a hard time with keeping the band on, so I would suggest maybe if you want to do this, if she had some lightweight shoes, it'll probably stay on a little bit better, or some rubber bottoms.
So we talked a little bit about patients that are unable to sit, but then we have our patients that are able to sit. And so our rehab goals, we still want to think about maximizing function and promoting function, but we also want to think it's important to also remember that we need to hopefully prevent contractures and scoliosis from that sitting posture that they may have. And so you also want to think just from a standpoint of exercise activity. General conditioning with and without resistance is important, and so you have to think through using either concentric or eccentric exercise. Again, whether or not you're working against gravity or using gravity as it being helpful. Aerobic exercise is important, and aerobic exercise can be done, like we said, in swimming or in the water. Using adaptive sports, wheelchair sports, or even hippotherapy can be aerobic in quality. And then if able, doing a supported standing program where, again, we mentioned kind of the frequency or the duration would be working to where you're standing up to 60 minutes a day, 3 to 5 times a week. So here's I'll let Tina talk about these chin tucks that we put in.
And well, see, this is applicable for people who are not able to sit and able to sit. What we found is a lot of patients start gaining some neck strength, and that's really essential if you're driving your power chair and your head falls to the side and you're not able to get it back up. So a lot of our patients are working on strengthening. So here it's hard to see with the mask on, but we're asking her to do a chin tuck where, for me, if you could see me, I have my thumb resting on my sternum. I don't know the normal name for it right now. And then my finger on my chin, and I just tuck my head back. Okay. And then you tuck your head back and you hold it in that position. And that is the stabilization we talked about. Once you get really good at that, then you can start rotating your head and add the dynamic component of it. But this is one of the examples that we have that focuses on neck stabilization. That may be helpful.
We talked about using or working the upper extremities when you're lying on your back, but you could do them sitting as well. And the same kind of principle applies as far as how tight you have the band and how much range of motion you can work through. So working on those biceps, trying to flex or bend the elbow. And then again, I could loosen the slack a little bit so that, again, now she's able to move through a little bit more of her available range. And then for the tricep, it's just the opposite of extending or straightening the elbow. So here she's able to extend, but she's extending just to that kind of 90-degree kind of motion. So bringing her arm off of the side of the armrest so that then she can actually extend all the way through her full available range. Working through that range is another kind of option. Okay. What you'll find is that our patients with SMA do have muscle imbalances, and so it's going to be a little bit harder for them to do the extension part of the exercise, and it may be a little bit easier to do the flexion part of the exercise. So being aware of that is something that can help you kind of understand how tight you may need to have the band or how much slack you may need to have. And then working on upper extremities, you can work a little bit on what we would call rotation of the shoulder. So we're working a little bit of the kind of the stabilizers of the shoulder rather than the arm muscles. And so on this one, just pulling it out against the resistance of the band. And this is more kind of an isometric exercise at this point, just because she's holding at an end range. Whereas in this example that Tina kind of gave us now, again, and Tina, you can kind of talk to how you were holding the band, but now she's moving through that range at a different angle, still working those rotators at the shoulder to help work with that stabilization. And again, it may be that, helping assist one direction and resisting the other direction is something that you would work on. So assisting kind of out by supporting the weight of the arm here, and then having her work through that range of motion so that she's rotating the arm in a supported position. Anything else on that one, Tina?
Yeah, no, I was just pointing out, I was supporting at the elbow so that her elbow's not going in and out, because we're specifically targeting the stabilizers, the internal and external rotators of the shoulder versus the larger shoulder abductors that she tends to want to compensate and use. And so this is a very focused activity on working the stabilizers of the shoulder.
More shoulder kind of stabilization, you can work on actual, we talked a little bit, Tina talked about how you pull that shoulder blade back and down. This is a little bit more of a harder exercise where you're actually rowing and pulling those shoulder blades back and down. One thing that I think is a nice thing to really point out in this video is with this very first row, if you watch, there's a lot of shrugging through the shoulders. And so I kind of remind her, keep your shoulder blades back and down, and then she's able to correct that. And that's what we were talking about when we mentioned watching for compensations, watching for, not able to do the exercise the way it was intended. And if that's the case, then it may be too hard and you may need to back off just a little bit. Doesn't mean you don't do it. You just might find a different way to make it a little bit easier. So this is an example. I'll let Tina talk through this. So same, I'll let you talk, Tina, sorry.
Yeah, no, you're good. We know our videos. So, so this is kind of a similar thing. We wanted to show a modification of a row as well. So I'm taking gravity away, so to allow her to do that motion of a row. And this was after we went through the process of her learning to do, a nice, shoulder, squeezing her shoulder blades together. But a thing to remember here is that when we talk about range of motion, you can do it in different ranges. So initially her elbows were up by her shoulder. You also need to change that position and have her strengthen also at the elbow a little bit lower, because all of us function at different heights when we need to use our muscles. And so we need to strengthen throughout that range up and down as well as in and out. So keep that in mind when you're also doing some of this strengthening.
Okay. I love this one, Tina. I'll let you talk through it.
I was like, which one was this? So this one, we thought it was nice because a lot of the tasks she needs to do is on the table. So this integrates the shoulder stability where we talked about, where she's really activating and pushing down on the shoulders. But you can see here, there's so much stabilization that needs to happen with her hands as well. So her hands are rolling off the ball, so she has to stabilize that before she pushes forward. And you can see what my hands are doing as she's working. I'm stimulating those muscles because when the muscles have, say they've been asleep for a while, you want to wake them up and remind them this is what needs to work when you are actively moving. And so this one allows us to have a little bit more concentrated neuromuscular stimulation physically, as well as they're going through the motion with this one. Anything else you want to add there, Leslie?
Yeah, no, I think that's good. Okay. Lower extremities are just like upper extremities, as far as you're going to work on bending or flexing, and you're going to work on extending. And so again, it may be that you may need to work through different ranges, and again adjust and the tightness of the band, and so it's harder to extend. So it may need a little bit more slack. Or it may be that maybe I need to assist that extension. So I need to be on the other side of the leg and actually help extend and take the weight of the leg so that she's still working that quadricep muscle to extend, but in a way that's being helped some. And then not only for knee flexors and extensors, but also working on the hip abductors, the muscles that your hips go out, and then your adductors where they come in. So again, working against, pulling out against that band, trying to separate the knees and push out into the band to work on hips. And again, you may not see that there's a lot of range of motion there, but just the activation of pushing into that band is going to help facilitate those muscles and help with strengthening and stabilization there.
Yeah, and the only thing I'd add to that is that when we were doing this, we also focused on, remember that ball scenario that we showed you before, her focusing on activating the lower abs while she's doing the lower extremity movement. So there's a combination of kind of like activating the pelvic floor and trunk, while she's also activating the leg muscles. And just a thing to point out here, when Leslie was talking about the lower extremity muscles, just like there's muscle imbalances the upper extremity, in the lower extremity, the flexors are also typically stronger than the extensors. So keep that in mind when you're managing the bands with these exercises. And you can kind of do the same thing with the ball squeezes here. We just figured you may have balls at home.
Yep. So just working that other side of the hip, in the inside of the hip.
Yep.
Okay. And then this one, Tina?
So we showed you this one before, really just now integrating what you've seen before with the ball. She's squeezing the ball together and adding those pelvic tilts. And you could see that with adding the pelvic tilt, she has some tight hamstrings. And so even just anteriorly tilting her hips, she stretches those hamstrings. So that's the only point in this this video again, being shown again.
Yeah, the only other thing I would add is there's a little bit of a little bit of a lift here, and that's what I would assume you're talking about a bridge there, Tina, where you're actually trying to work the butt muscle in order to you're kind of pushing down in order to lift the hips up to make a bridge, and that works on your hip extensors, which can be really important when you're working on things like tall kneeling or even in standing. Activating those hip extensors is important, and so this may be a way where you're actually having them not only pelvic tilt, but lift the hips up off of the floor in order to work on those muscles a little bit.
Right, and that's a really good point you make too, because when you're lifting the hips, the ball kind of allows good biomechanical alignment, and so then it allows the legs to be in good alignment to do this activity, and then your cue is going to be for her to push down with her legs to lift those hips together. So it's a movement that encompasses multiple joints and stabilization that could translate well to some functional activities.
Okay. And I mentioned tall kneeling and half kneeling, and so Tina was gracious enough to demonstrate some different exercises. So this is a little bit of a progression where in the chair we were working on moving those hips out into the band, resisting out into the band. Now with the resistance of the band, also kind of moving from side to side to work on that. And so I think, Tina, there you're kind of talking about posture is important. Again, that compensation and watching for that. If you feel like you're seeing that you're bending forward at the waist a lot, then you're probably you need to think a little bit about being more upright and working the body in a better way so that you're not using the muscles that are already strong. The intent is to work those muscles that are weaker. And so thinking through that. Anything you want to add there, Tina?
Yeah, so to get upright, the muscles that we talked about the pelvic tilt laying down, the glutes are what you need to activate to kind of get that upright posture. So those are the primary ones to focus there. And the second video is the same, is focusing on the pelvic girdle muscle, similar to what we had the young lady doing sitting down. You can also do this in a half kneel position. And so it strengthens the leg that's weight bearing. And that's going to be really important for standing activities. And then on the other leg, you're using the other band to strengthen the actively in a concentric manner, strengthening those muscles. And what's really important when you progress to walking is the ability to shift your weight, co-contract the muscles around the hip joint, the knee joint, and the ankle to be stable before you move the other leg. So these are the progressions that we go through in our head as we kind of break down a task, especially as you transition from like, say, a kneel position to a walking position.
Okay. And then these are, I call them clamshells, same kind of concept. Now, rather than being kind of up on the knees, you're still working those muscles, but lifting kind of up against gravity as well as against the resistance of the band to work those the sides of your hips a little bit to, again, just help promote that stability.
Right. And the thing about this one, to make it kind of fun, is you can have it a game. You can have little like sandbags or something. And the game is they try to open up the animal's mouth, or, the alligator's mouth, and you try to throw in the bean bag. And so it's not work. It's kind of fun, so you can add that little component to it.
Yep. So from when we transition then to our patients that are able to walk, again, we still want to think about all of those same rehab goals. We want to maintain function, but we want to prevent contractures and scoliosis. Aerobic and general conditioning exercises are going to be important. So those same concepts of swimming, walking, cycling, yoga, hippotherapy. And then strengthening, again, same kind of thing. If you need to use gravity eliminated postures for weaker muscles, then that's okay, use that. If you need to assist the range of motion for full range of motion of strengthening, use that. So just thinking through how you would progress. So again, in this video, just kind of quickly, what I would say is we may be looking at working the arm muscles, but also while doing this in standing, she's having to stabilize her whole body. And so that's kind of what we would call dynamic standing. You're having to keep your body stable while you're moving other parts of the body. And that can be helpful when you're starting to, when you're needing to strengthen. I think that, I mentioned that if exercise were a pill, right? If exercise were a pill, we would all do it, but it's not. And so we have to find ways to motivate and to gain cooperation, and that can be difficult. And so Tina mentioned, finding ways to make it fun, make it a game, and then think about those community or adaptive sports groups that they're working with their peers, and that may be something that's an incentive, basically. You do really need to think about the fact that it does need to kind of be a habit. And so decide what days a week are you going to work, and then maybe even thinking through support groups or friends that you're going to work out with and exercise with. And then the other thing is make sure that you set achievable goals, especially up front and early, because if you set a goal, if I've not run in the last 6 months and I say I'm going to run a marathon tomorrow, that's just not going to happen. And so then I'm going to be disappointed and kind of feel like I didn't meet my goals. So I want to set goals that are achievable, and then when I achieve them, set a new goal. And so make sure that you're kind of able to progress yourself in that manner. This was just an example of a nice kind of exercise calendar that Tina put together, where again it incorporates all of those frequency and intensity and time principles. And it can track it over the week. So something like this might be helpful. And then we do want you to consider and take into consideration, remember, you do want to talk to your physician and your physical therapist and realize that there are potential risks with exercise. There are, increased injury is a possibility. If you do have bone fragility, and there is a fracture risk and over fatigue, but there are things to do to prevent and to kind of keep those things from happening. And so don't let those risks scare you away completely, because the benefits really are numerous. So with that, I think that I hope we have a little bit of time for questions. Anything else you wanted to wrap up with, Tina?
No, I think the use of words. So I would say with kids, if they don't like the word exercise, or exercise has a negative connotation, make sure you use something like play, because words matter, I think, particularly with kids. We don't want exercise to be a bad word.
Yeah, for sure.
Thank you so much, Leslie and Tina. Hi, everyone. This is Dr. Mary Stroth with Cure SMA. Next, we're going to go over a few questions that have come in from the community. And thank you for submitting your questions in advance and also during the webinar. My first question is, can you provide an example of isometric exercise, just to be really clear? But what is isometric exercise?
So isometric exercise is when basically the muscles, there's a how do I say this? So basically the body's standing still. You're not going to be moving in space. And so you're pushing against something so that the muscles are contracting, or what we would call co-contracting. So the muscles are kind of working together to keep that limb stable. So an isometric exercise for my tricep would be, I would push against my hand. I'm facilitating that tricep to work, but I'm not actually moving the tricep or lengthening the tricep whenever I'm moving through. So the muscle basically is staying the same length, and I don't know if that helps. So pushing against something without the limb moving would be an example of an isometric exercise. What else, Tina?
Yeah, I mean, I think that those are good examples. I would say anytime the limb doesn't move, it's probably an isometric exercise. And like say planks, for example, if you hold a plank, that's an isometric work of your abs and your trunk together. So just think of two sides. If both sides are working together to hold something in place, that's isometric. And it's important to do, because that is what's going to keep your joints safe from bad biomechanics. So you have to have a strong base to work your legs and arms from. And so isometric exercise is recommended for as a core to strengthening.
Thank you. No, that's great. I have a question about the exercise with the bands around the thighs in tall kneel position. Would this be safe or good to do with a 22-month-old? Type 2, crawling, cruising, pushing, pulls to stand. Thoughts?
What I would say, I mean, if they are cruising, I would say most likely yes. So you want to make sure that anytime you kind of think about an exercise and how you progress it or how you make it harder, is you do want to think about safety. And so what I would say is, if they're able to get in the position without the band and maintain that position with relative ease, then adding the band is something that you could do to then make the activity harder, and that should be something that you could try. You always do want to make sure that you're monitoring, moving things out of the way if there were to be a fall, or supporting them as needed. And then the other thing is too, you don't want to just kind of ask them to do too much right away. So working into an exercise is something that you want to think through. Again, it's kind of back to I don't want to run a marathon today if I haven't run a mile yesterday. So working up to that is what I would suggest to kind of verify whether or not they're capable of doing it. I don't know if that really answers the question.
Yeah, and I would say focus on mechanics. So if they're in that kind of crouched position, and I wouldn't necessarily add the bands to that. I would really work on more the extension, getting into that kneel position if that's the case, versus those are two different hip muscles you're working on. Stepping to the side, you're working on that side hip muscle, but getting your bottom up and not with the not have the bottom stick out is the other hip extensors that you really want to work on. So depending on what your child looks like, just make sure that they're upright and not doing it with their bottom stuck out.
Thank you. I have a question about a hip, knee, foot orthotic, HKFO, with hinges at knees and hips. How can they use it more dynamically than just with standing without hurting themselves as caregivers?
I think we mentioned this a little bit on weight shifting. And so with the hip, knee, ankle, foot orthosis, it provides support at all of those joints to keep your child upright. And one of the muscles or the prerequisites to walking is, like we said, weight shifting. And so what you could do is have them, it's kind of like dancing, right? You could slow dance together and just they shift their weight on one leg, and it gets an isometric contraction of all the muscles on the standing leg. Then they shift to the other side and they're isometrically contracting the other leg. And like we said before, those are prerequisites to walking. And so then you can do that instead of just standing and hanging on the braces. That's something active that you can do, and find a song you like. I'm sure there's tons of Disney slow songs that you can dance to.
Great, thank you. Do you recommend bracing to prevent scoliosis in sitting children?
This is a tough one.
Yeah, it's a great question. Yeah. And I think it's one that Tina and I both ask each other probably. So what we do know that there's not a ton of literature out there that really tells us that bracing is going to prevent scoliosis. But what I would say is that there may be, we mentioned that you may need to use bracing to help with stabilization so that you're in a more upright posture so that you can focus on using your arms or have better head and neck and control when you're supported at the trunk. So there can be reasons for using bracing that can be reasons other than preventing scoliosis. I think the other thing, as far as with scoliosis and now even with our disease modifying therapies, we're really in a situation where muscles are changing in ways that we're not used to seeing in SMA. And so now it's harder to answer that question in regards to patients that are now being treated by disease modifying therapies as well, because we're, the progression of how you're strengthening and how you're gaining different motor function is changing from what we used to see 10 years ago. So that's kind of that's the complicated answer to a complicated question. Is it recommended? I think yes, in certain situations it's very much recommended. But I wouldn't say that it's necessarily to prevent scoliosis. Tina, please elaborate.
Yeah, no, I agree with you on the brace stance. We talked a little bit about compression or Spigos and different things that could also be used that are not hard braces that could be considered. But it's a hard one because the evolution of the disease is changing. But I think one of the things we focus a little bit more on are some of the trunk stabilization exercises that we showed you in some of the videos. But from a yoga perspective, cat cow is nice because you get that mobility, but then you get into that quadruped and you're holding it as your child's getting a little bit better at, the bug, arms and legs, or, if you're even stronger, add planks. But those are the things that I think I know that, we've kind of recommended a little bit more to try to get those muscles to help stabilize at the spine when before we're not sure they were able to do that.
Yeah, I'll also put in a plug for appropriate seating. So in a custom chair, you can have seating that's appropriate that keeps the spine in a better upright posture when you are in that seated posture. And so I would just put in a plug for kind of encouraging that don't forget that component as well.
Good point, Leslie.
Thank you. Is cardio exercise important for non-walkers, and how can we help our child get cardio if needed?
So yes, definitely. I think it's something that the cardiovascular or aerobic type of exercise could be beneficial. And if you can't, if you're unable to walk, then using your arms is one way. So I think I mentioned that, a bicycle or they do have arm bikes, upper extremity bikes that could be something that could be useful. Swimming, being in the water can be aerobic. What else, Tina?
Yeah, so the arm bike too, if they have a lot of weakness, keep in mind that you can buy one with a motor, and the motor can assist. So then you get some exercise, and it's successful as well. And so maybe they can do it for a little bit longer, because with cardiovascular exercise, remember, we're trying to get duration more than repetitions. So.
And it's okay to build on that. So if you can only do 5 minutes today, you work to do 6 minutes tomorrow, and you work to do 7 minutes the next day, and kind of build that endurance as you start out.
Yeah, and I would like to also plug in what you showed earlier, Leslie, about the slings and springs. Take away gravity, and then moving the arms up and down, doing all sorts of different types of activities. That's also cardiovascular as well, in these exercises.
Thank you. One last question. I have a question about the possibility of too much exercise. Is it possible to have too much exercise, and can they destroy and lose muscle?
So I think from the standpoint of what Leslie was saying about overwork weakness, there's a study published, I can't remember what year it is, 2017, 14, I don't know, with Kristen's group, where they looked at strengthening, and they did not find strengthening to be harmful. But one of the caveats about strengthening is to watch for overwork weakness, and that happens basically if you're working out and then the next day you can't feed yourself. That would be a sign that that's what overwork weakness is. And so I think monitoring that helps you individualize what is too much for you. From the perspective of the muscle being destroyed, that's not what we understand in the biology of SMA muscles. And so unlike what you may read about, say, muscular dystrophy or dystrophic muscle, you don't have the problem with the infrastructure of the muscle breaking down and not being able to rebuild. So you're able to do that. But with SMA, you should build up slowly regardless.
Yeah, and I agree. The only thing I would add to that is thinking through how do you know before the fact? That's when you're cueing into, are you compensating in some way, or are you unable to complete, the number of repetitions that you were wanting to do? Then you're probably doing a little bit too much at that point, and that may help prevent kind of that fatigue the following day. A little bit of soreness may be something you experience, and soreness doesn't necessarily mean overwork fatigue. Soreness, especially even a day or two after you've exercised, can sometimes happen just because the muscle has broken down some different properties, and so you get a little bit of soreness in the muscle itself just from the muscle working. But again, I would go back to Tina's point that if it's limiting you from being able to function in any way, then that's important to back off and to think through, what did I do and how do I need to modify that to make it easier?
Yeah, Leslie, I'm so glad you brought up delayed onset muscle soreness. Sometimes we forget to mention that is a normal occurrence with exercise, and that it definitely is okay. And if you do have soreness, do the usual, drink lots more water, and it should go away. People have the onset is between 24 and 48 hours. So I'm really glad you brought that up.
Great. Well, thank you both so much again, Tina and Leslie, for such a wonderful presentation today and answering all of these questions that came into. We really appreciate your time and sharing with the community today. So thank you both. And thank you so much. Oh, yeah. And thank you so much to everyone who attended today's presentation. You will be receiving a follow-up email with the survey link, and we welcome any feedback that you have to share. And we're also so grateful for the incredible support from our presenting sponsor, Biogen, and supporting sponsor, the Luke 18-1 Foundation, for making the Physical Therapy webinar series possible. And if there's anything that we can do for you, or if you have any additional questions, you can always email us at familysupport@curesma.org. Thank you so much and have a great night, everyone.
Great. Thank you.
Thank you.